called on the scene of a 64-year-old female with a possible heart attack. You arrive on scene of a well-kept farmhouse with the fire department on scene. The husband greets you and escorts you to the patient. The patient is currently conscious and alert and in severe distress on the floor with a clutching your chest and crying.
Okay. Scene safe. Everything's good.
Yes.
PSI.
Yes.
So,
Is this our patient?
how you doing, ma'am? Ice tracing and everything else?
Yep, she's tracking you. She's
Great.
chest hurts.
Oh, just your chest hurts? Yeah, let's get a full set of vitals and put her on the monitor.
Monitor first, or
Just everything.
everything? Oh, yeah, any monitor. Are we hooking up to the thing? Okay.
So, hi, ma'am. My name's
Stick 'em
Arsen.
on
How
the
you
patient.
doing?
I'm doing bad. It hurts.
You doing bad? What's going on?
My chest hurts really bad.
How long has it been hurting for?
Like 15 minutes.
15 minutes. What were you doing when this started?
I was washing dishes.
Washing dishes. Okay. Husband in the room?
Yep.
Alright.
Monitors
I'm gonna have the husband grab a med list for me.
Yeah.
So,
I'm getting your wife.
monitor's on. What do we have going on?
Normal sinus.
Normal sinus with the chest pain. Alright. What's the pulse ox at?
94.
94. Pulse ox.
Do you want oxygen?
Let's give her a little oxygen. 3 liters at this time by nasal cannula. And then, so, ma'am, we're gonna put you on a little oxygen. Hopefully that'll make you feel better.
Okay.
What does that pain feel like? Does it crush
It's
or
like a squeezing pressure on my chest.
around your chest? I'm gonna touch you if that's okay.
Yeah,
Alright, does this make you feel better or worse?
neither.
Neither? Alright. That's my partner, ALS or BLS?
What do you want?
This is not staying.
ALS is fine.
ALS it is.
So, alright, so. I'm gonna give her 4 of aspirin, 81 milligram. 4 of them, a total of 324.
Okay.
What for pulse?
96.
96. Strong radio?
Yes.
So, what's my O2 stats with her now?
95.
Okay. Ma'am, does it hurt anywhere else? Does it radiate from one point to another?
Yeah, it feels like it's moving down my arms and into my neck.
Okay. Can you chew up these aspirins for me?
Yes, it can.
Okay.
What?
Rapid BP?
136 over 84.
I'll remember.
So, alright. So, aspirin's on board. How's that feel with the aspirin, darling?
Feels alright.
Alright. Is that pain still the same?
Yeah, it's still the same.
I'm gonna start an IV.
Did you already get mine?
No, not yet.
Second two?
Yeah, we'll give. What was the blood pressure again?
136 over 84.
Yeah, we'll give it 2.
2?
Just the 1 right now.
Oh, okay.
Alright, man, lift up your tongue, okay, ma'am? And spread it on your tongue.
0.4.
Have you ever had nitroglycerin before?
No.
Alright, shit. You might feel a little lightheaded or dizzy with this.
Are you allergic to any medications?
I only get the morphine and aspirin.
Do you have a true aspirin allergy? What happens when you take aspirin?
I'm not supposed to take aspirin because I have an ulcer, and my doctor says I shouldn't take aspirin.
Oh, okay. This time we'll do that and then just get you squared away, okay?
Yeah, I trust you. Whatever you want to do.
All right, cool. How many people tell me that? You want to set this up? All right. Wiping the thing outside into outside. I'm gonna do it on this arm, sharp out. How's she feel with that aspirin?
Still hurts.
I mean, with the nitro, can you recheck that?
She said her head hurts.
Her head hurts?
And my head hurts now.
Okay. How bad does her head hurt?
Go ahead for lung sounds.
A little bit. Lung sounds are cleared ankle bilaterally.
Alright, small poke. Poke. Sharp away.
What's on BP?
136 over 84.
136 over 84.
Flush is good.
So yes, med list history and everything like that?
Did I get the med list back yet?
Yeah. He takes Tagamet and Prozac.
Prozac. Alright. Secure the IV. 18 AC. So, alright. You know, how did that pain go away at all?
No, it still hurts.
No, still hurts. Alright. Well, we'll move to fentanyl. Give her a little fentanyl. 25. Alright.
Sorry, how much is it? 25 micrograms?
Start with a little bit. Have you ever had fentanyl before?
I have not.
You have not?
What do we have on monitor?
What's the, yeah. What's my rhythm on the monitor still?
Normal sinus.
Normal sinus? Okay. What kind of medical history do you have besides?
I just have ulcers. I'm a little sad sometimes. That's it.
Okay. So do you see somebody for that, darling?
Yeah.
Yeah. Drug.
Still set at 95?
Alright, wiped it off with the alcohol prep. A little bit of morphine.
Have you ever had this kind of pain before?
No.
No.
Never.
No.
How was your written pain?
Alright,
On a scale of
flush.
1 to 10.
10.
No. 10 right now
10?
still?
10.
How many minutes since this? You were not intro. Do you know them?
How's that fentanyl feeling?
It still hurts.
It still hurts?
Yeah.
Alright, let's take a blood pressure again. Make sure. See where we're at, and we'll load and do everything else in the back of the rig. What's my rhythm at with that morphine, or the fentanyl?
Still normal sinus.
Okay. Pulse,
96.
remember that?
Changed. BP?
What do you think?
Hmm?
What do you think?
136 over 84?
Yeah.
Alright. Cool.
Alright.
Very natural.
Yep, let's give her another spray of nitro,
Alright, man, you want more spray on your tongue here, okay? Put your tongue
and
up.
then
And
let's get the fire here.
Yeah.
Alright, so we're gonna get her loaded up to the gurney. Am I on any second story or anything like that? Okay. So we'll get her loaded up and down into the rig. So, what's my nearest cardiac center?
It is 11 minutes away.
11 minutes away.
Alright,
Alright.
ambulance now?
No, take us a couple of minutes to get down the stairs. Yeah, we're in the back of the rig. Let's do a 12 lead
Good.
to keep her nice and decent. Should be on 12 lead over there. Maybe the stickers, I'll put them on once. Because we don't have the 12 lead in there.
No, we don't have to go back.
So second. Sorry about this, I'm gonna lift your boob up with the back of my hand and place some stickers under there, okay ma'am?
Okay.
How's that pain doing now? Any better?
Nope. Still hurts a lot.
Still 10 out of 10?
Yeah.
Alright.
What does it feel like?
It feels like just squeezing, crushing pain.
Okay.
Let's go over the transmit.
Alright, for 12. Alright, take a look.
Yeah, she's got ST elevation in B2 and 3.
1, 2, 3.
Yep, so ABF. One, so. Alright. So,
So lateral, septal,
it's
and yeah, lateral septal.
inferior.
Okay.
In my neck of the woods, we'd start a helicopter. So,
How far away
I
from
would
you?
like to start a
We're
helicopter.
in Imagination Land. You're 11 minutes. You're 9 minutes from cardiac center.
Alright, I'll just go to that then.
Sounds good.
Drive code 3.
Yes, sir. Watch dogs and deer and all that good stuff. Take it nice and smooth.
Would you like a fire rider?
Yeah, I'll take a ride along.
Okay.
I'll be your
You're
rider.
BLS now. You're probably part of BLS.
Alright, ma'am. I'm gonna do a second. I'm gonna touch you a little bit. How's your eyes? I'm gonna check pupils. Make sure pupils are good. Make sure pulse is still good.
Equal rounding up the leg, strong regular pulse.
Okay. Blood pressure again.
136/84.
136 over 4. Okay. You want to take a look at something, or I was just gonna borrow it out there. Oh, I won't put them on my ears. All right, take a breath for me. Breath. Again. One more time. All right, sounds clear. All right, so should have brought a pen. Slacker. Normally,
136/84, 96 pulse. 10/10, crushing, chest pain.
so
Your cardiac history, hip ulcers, and depression.
no cardiac history.
We have
So
elevation in leads. We got 1.
1, 2, 4, 5, 6. You know what?
Indicative of a.
I'm gonna take the while I'm in the back of the rig on my way. I'm gonna do a right sided just because I can. What's
No
the-
change.
Alright. Alright, still gonna code 3. I'll try to give a radio report because I'm a slacker and didn't bring a pen.
Okay.
So, whatever hospital, medic 7011, code 3 traffic.
Cardiac center, medic 7011, go ahead.
I'm in route, EMT, paramedic Barbeau en route to your facility. Code 3 with a 60-ish-year-old female, complaining of chest pain today. Substernal. On the, arrived at scene, found female laying, sitting on the floor. Husband was there saying that she had chest pain. Asked the patient. Patient stated that she has like a squeezing in her chest upon evaluation. First set of vitals as seen as follows. I had a blood pressure of 136/84, pulse rate of 96, respiratory rate was 20. Lung sounds were clear, and satin 94%. Patient was placed on 3 liters by nasal cannula, which the O2 sat came up to 95. Still have her on the nasal cannula at this time. Did a 3 lead with normal sinus. Patient still was complaining of the squeezing pain, so I gave her ASA at 324 milligrams and 2 of 0.3 of nitro. I gave her fentanyl at 25 micrograms and with no change and nothing to report there. Pain is still 10 on a 1 out of 10. Did a 12 lead. I have elevations and V2, 3, or V2 through V6. Did right-sided EKG as well with no change. I believe she's having a inferior MI. I'm still en route to your facility. She has an allergies of aspirin, or which negative? No aspirin. Morphine. Still en route to your facility with code 3 with an ETA of
4 minutes.
4 minutes. Do you have any questions or orders?
No questions or orders. See you in 4.
Alright. Monitor throughout transport. Checking that. What's her blood pressure at?
136/84.
136. Alright, give her another nitro.
Okay.
And then fentanyl, a little bit more fentanyl throughout route, which would be another 25. So that's a total of 50. How you feeling now? What's your pain at?
10.
Still a 10?
Yeah.
It's gonna be okay. What was your name, miss?
Beverly.
Beverly?
Hi, Beverly. So,
I'm sorry you're going through this today, Beverly.
yeah. Any change in monitor? Let's do a recheck on that there since we gave her a little fentanyl. And
Nope.
nitro.
No change to the monitor or blood pressure or lung sounds or anything.
Okay. So
Damn it, Beverly.
dang it, and I still have time. So now it's just all about talking to the patient and see how she's doing and monitoring vitals throughout transport. And blood pressure was still the same.
Mm-hmm.
What else could I do? The second IV. Could do the second IV. Hang a bag. Should have hanged the bag from the beginning. I'll hang a bag. Keep everything flowing. Because I've been flushing everything with a flush because I'm handicapped. Alcohol prep. Then apply that. And hang that and run it at TKO. Any change in the monitor or anything?
Nope.
Alright, so I would have been given the nitro every 3 to 5 minutes apart.
What were you doing this morning, Beverly, before this happened?
Washing dishes.
Washing dishes.
Does the pain radiate anywhere?
Yeah, down my arms and into my neck.
Both arms?
Yeah, both arms.
So, no change in that. Give it fentanyl.
Do you see a doctor regularly?
Yeah, I do.
What do you usually see him for? Just for your depression and your ulcers?
Yeah, I saw him like 2 months ago. He told me to stop taking aspirin because my ulcer was getting worse.
Well, the amount of aspirin we gave you should have given any problems there.
Yeah, I'm not worried about it. I trust you guys. Whatever you think is right.
You're the best, Beverly.
Alright. So how about those Giants, Beverly?
Which Giants?
The ones in the hills.
Cisco.
Oh, the baseball Giants?
Yeah.
They suck again. I don't like it.
Alright, cool. Sharps away. So, alright, Beverly. How's everything going?
Yeah, it just hurt really bad.
You just hurt really bad?
Mm-hmm.
Okay. I'm gonna hold your hand here for a second. How's that sound?
That sounds great. Thank you. I feel better.
Alright, cool. So, what's her pulse rate at?
96.
96.
This is Beverly, you're
You're in better health than I am. Let's do this. So, alright. Blood pressure?
What do you think?
136/84.
Yeah.
Yeah, we'll give her another spray of nitro.
Sounds great.
What's my ETA?
30 seconds.
Blood pressure.
136/84.
Pulse.
96?
We'll hold off for 30
Roll
seconds
respirations?
out. So, respiration.
22.
22. Okay.
What's your stats?
95.
Still anybody? Let's cover off with this video. Should
Beep, beep, beep.
Alright.
Oh, we're backing in. Doors are open.
We need to sign this form here, so.
Oh, okay.